The Ghana Prison Service is taking a significant step to improve healthcare delivery within correctional facilities with the introduction of a prisons service drug bank. The initiative is expected to enhance access to essential medication for inmates and address long-standing concerns about health conditions in prisons. Joining us to tell us more about this initiative is ADP Dr. Augustina Ama-Boadu, Administrator, Prisons Clinic, Roman Ridge with the Ghana Prison Service. Good morning, ADP, and good to have you on News Highlights. Hello, Doc. Hello. If you can hear me, what informed the decision to establish the Prison Service Drug Bank?
Hello.
Good to have you on News Highlights. I hope you are fine.
By the grace of God, I'm well.
We thank God. We want to know what informed the decision to establish the Prison Service Drug Bank at this time.
Thank you very much. Good morning to you and your viewers out there. So, what informed the establishment of the Prison Service Drug Bank can be put simply into the following statement. So we all know that prisoners all over the world bear a disproportionate burden of infections. So we now have witnessed emerging situations such as COVID-19, monkeypox, and a host of other infectious diseases. Coupled with this, there is limited availability of resources for the prison service to be able to cater to the health of inmates adequately. So one of the strategies that has been devised by the current Director General of Prisons is to strengthen collaboration with stakeholders. And so the concept of Prisons Drug Bank came to the fore, where we mobilize stakeholders, corporate Ghana, public organizations, NGOs, CSOs, bring them around the table, discuss the need to ensure adequate healthcare in the prisons so that we can mobilize medications into a general pool for onward distribution to the prisons across the country, so that health professionals in these prisons can have medications available consistently to take care of the health of inmates. For we know that prison health is public health. Whatever happens in the prison has implications for everybody outside the prison.
So how is this going to operate within the prison system?
All right. So this is how it will go. There will be a central management committee at the prison headquarters, and there will be a facility at the prison headquarters, but then it will be decentralized. And there are 4 zones. We have the northern zone, the middle zone, the southern zone, and then we have the coastal zone. So all these zones will go out there to their districts, the regional capitals, institutions, and all stakeholders in these regions and mobilize drugs, essential drugs, medical equipment, and other supplies at their levels, and then distribute them to the individual prison facilities within their catchment areas. There will be a central management committee made up of experts who will manage, monitor the activities of these zones that we'll have to ensure efficiency, effectiveness, integrity, and accountability.
ADP Boadu, who are the primary beneficiaries of this initiative? And is it going to cover both inmates and prison officers?
Right. Thank you. So the primary beneficiaries of this project is prison inmates. To a very less extent, officers will also benefit because they come to work on a daily basis in their line of work. People may fall sick, issues will happen, and they will need emergency medical care. And that is where this prison drug bank, if established, comes in handy to support officers in their line of duty. But primarily, inmates are the beneficiaries.
Okay, and what medications are we looking at to be stocked, and how will you ensure they meet the health needs of inmates?
Okay, so medications, all kinds, antibiotics, antimalarials, antihypertensive, antidiabetics. Any medication at all you can think of that can support the health of inmates, we are ready to receive them.
And how is this going to be funded, and what measures are in place to, ensure its sustainability?
All right. So the funding will come from many sources. Number one will be from government of Ghana, because the prison service, as you know, is a government-subvented institution. So governments will support, through the normal budgetary allocation. In addition to that, we are in collaboration and in contact with my pharmaceutical companies. The Pharmacy Council is on board, and the major pharmaceutical companies in Ghana are on board. And then also we have NGOs, CSOs, we have faith-based organizations who have also pledged support for the drug bank, to ensure that this whole project becomes beneficial to the inmates and it is sustained. We have put measures in place. So first, I have said that there is a committee that will, from time to time, assemble stakeholders, reach out to donors, funders, philanthropists, and also solicit medications, money to procure medications into the system. But most importantly, this project is a key pillar under the Think Prisons 360 Degrees initiative that is being spearheaded by our current Director General of Prisons, where there is a fund, there is an account with account numbers that have been circulated, that so that every now and then people have opportunity to donate. 1 CD, whatever amount they can donate into the fund. And we ensure that we are sure that when this is well managed, we'll be able to sustain the project.
Finally, what challenges do you anticipate, and how do you plan to address these challenges?
Yeah, thank you very much. So every initiative comes with challenges. So the first challenge will be donor fatigue, because we are hoping that we will receive massive support from organizations, and every now and then we are going to call upon them. We are seeing a situation where with time, people get tired because the prisons will never get closed down. They will continue until, Christ comes. And so we'll continue to knock on the doors of people, organizations. We envisage there may be donor fatigue. But that is why we have established the fund, and the service is also restructuring its systems so that will increase internally generated funding to support the project. And then also, we also envisage, it's a human institution and people are going to manage. and there may be wastages here and there, diversions, to a very less extent. And that is why the committee has been constituted to ensure and put in place systems to monitor, to track the movement of medications, movement of the supplies that have been given to us, so that we, what do we call it, reduce to the barest minimum any kind of diversion or theft or whatever it may be.
Very
So
much.
I think that with this, we'll be able to make a headway.
Thank you so much. So you just heard from Dr. Augustina Amabuedu, Administrator, Prisons Clinic, Roman Ridge, with the Ghana Prison Service, telling us about the significance of the drug bank that will be launched by the Ghana Prisons Service.